think we should all aim for a healthy BMI. For East Asians like us, the BMI or body mass index that we should aim for is probably about 23, maybe up to 25. And I think once you hit about 30, it's quite significantly overweight, and you probably want to cut down at that point. Interesting question. So we actually see a lot of elderly patients nowadays with knee problems, especially in Singapore, where we have one of the oldest populations in the world. Many of our patients live well into the 80s and 90s. So the answer to this is that there is a very good chance that we have a successful TKR, up to 90% chance that the TKR will be successful in terms of reducing the pain and giving the patient a very good functional, stable knee to get around every day and to do daily activities. Age doesn't seem to be that much of a problem. More so, it's how healthy the patient is, whether or not there are other medical problems like bad diabetes, bad heart disease, previous strokes. These are more important in determining the outcome rather than the actual age of the patient. In terms of osteoporosis, it's usually not a problem as well. Many of our patients are osteoporotic and they do very well after a total knee replacement. But we have to be more careful during the surgery to make sure that the operation goes smoothly and we handle the bones with more care because they're more fragile. It could be either, actually. A lot of my patients who have rheumatoid arthritis or they have simple arthritis, they both say that when the weather is bad, they seem to get worse pain in their knees. So I don't think it really helps to differentiate the two. Both groups of patients seem to have this problem. Yes, so flat feet are very common. Not everyone with flat feet has pain or problems. In fact, many people with flat feet are actually very active triathletes or marathon runners. So not everyone with flat feet has a problem. But some people with flat feet do get pain on the inner side of the foot and ankle. And the protruding of the inner ankle bones, I think that is also a common problem as the flat foot gets worse. So depending on whether or not the flat foot can be corrected, i.e. whether it's flexible or whether it is a rigid deformity that cannot be corrected, we can address them with insoles at the beginning. So when you walk or when you run or you do exercises, we can get insoles to support the inner arch of the foot, and that can help to relieve pain in the foot. But if the pain gets worse and worse despite having insoles and doing physiotherapy, then sometimes we may need to do surgery to correct this. And in my own practice, normally when the deformity is bad, we sometimes have to do surgery to correct the deformity. And I do this using minimally invasive surgery, using 1 or 2 centimeter incisions, or using keyhole surgery, depending on what operation needs to be done. But nowadays, the technology is so good that even after relatively major surgery to correct the foot, patients are able to go home usually within a day or 2, and they don't have so much pain. And recovery. In Singapore, it's quite similar. The partial knee is maybe about 10% cheaper than a total knee replacement. Quite close, not much of a difference. Many complications that are possible, but if we look at the overall success rate after knee replacement surgery, and we take data from all around the world, 85 to 90% of patients are successful. They're happy with the outcomes of their knee or hip replacement, and they have no pain or minimal pain, and they're able to do work and get about their daily activities. About 10% of patients have problems, and there are multiple complications that could cause this. One complication could be infection. About 1 to 2% of patients get an infection of their hip or knee replacement, and that becomes a big problem because if the infection is bad, it often requires more than one or more surgeries after that to get rid of the infection, and sometimes even have to replace the knee and hip implants with new ones because of the infection. So that could delay recovery for a long time, 3 to 6 months sometimes, if something like that happens. Other complications include if the patient falls down, they might actually end up a fracture next to the implant. The metal normally doesn't break, but the bone next to the metal can break, and that might require another surgery as well. Over time, the implant can wear out or loosen as well. And so about 15, 20 years, sometimes the implant needs to be changed. Other things that are more rare would include injuries to the nerves or the blood vessels near the joint. That's very uncommon, usually less than 1% of that, because we know the anatomy of the area well, and we normally can avoid the arteries and the nerves quite safely. Sometimes after surgery, patients also get pain and stiffness in the joint because they don't do enough physiotherapy. Or like we saw in the example earlier, after a hip replacement, a patient was lying in bed for a long time and got pneumonia. So rehabilitation, exercise, physiotherapy is very important after hip and knee replacement surgery to get the best results and to minimize complications. This concept is quite a good one. There's this concept of peak bone mass. That means when we are young, our bones get stronger and stronger and stronger as we are in our teenage years and even in our early 20s. And so by the time we're in our mid to late 20s, our bones are the thickest and strongest that they'll ever be. And we call that peak bone mass. So how do we get thick and strong bones in our 20s is to have a balanced diet with good calcium and vitamin D intake. We also want to stay active. That means do exercise, go running, lift some weights, because weight-bearing activity also contributes to the thickness of the bone and the strength of the bone. So this is correct. I mean, we should aim to have good diet, good exercise, good lifestyle in our 20s. And if we get a high peak bone mass, then after that, when we're in our later years, the bone is better.
Terima kasih telah menyaksikan video ini. Dan jangan lewatkan video menarik lainnya dari channel Tekon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tekon TV.